Good evening, Team Kentucky. This is Lieutenant Governor Jacqueline Coleman, and I am here with some good news items today and some information to share with all of you related to a few initiatives. First, I'm going to start with the Kentucky Broadband Initiative. Reminder that we need every single Kentuckian to go to speedtest.ky.gov in order to take the speed test, which will give us data we need to build a map across Kentucky of the high and low points of internet connectivity. That map then will provide guidance for our public and private partners to be able to help us bring broadband to the last mile and connect every Kentucky household that we possibly can to affordable, reliable internet. And so before we can begin to do that, we really need everyone to go to speedtest.ky.gov and provide us with the information that we need to build the most accurate map. And I want to make a note here that the two places that we have pretty low participation from are our big cities. So folks in Lexington and Louisville, we really need you to go to speedtest.ky.gov and give us that data that we need. It doesn't matter where you live. We still need you to help us to build this map. And so the deadline has been extended to March 1st, and we need as many Kentuckians to take part in this as possible. I'm really happy to announce that we have topped the 72,000 number for people who have participated. So if you've participated, make sure that you remind your family and friends to do so too. Next up, we have a really exciting announcement about childcare here in Kentucky. You know, every single family in Kentucky knows that the COVID-19 pandemic has had a profound impact on our childcare system, which has had a profound impact on all of our employees and employers across the state as well. The coronavirus has forced over 300 Kentucky childcare facilities to close over the last year, some only temporarily, but some also permanently. But I am proud to announce that there is help on the way for Kentucky families and for our child care providers. The Division of Child Care at the Cabinet for Health and Family Services has received a $195.5 million in federal child care aid through the 2021 CARES Act. This money will be used in a variety of ways to reach Kentuckians in all 120 counties, including short-term necessities such as training and technical assistance to keep our work and learning environments safe. But this funding will address larger structural needs within the child care system by helping jumpstart hiring requirements like background checks and fingerprint scans, as well as providing co-payment assistance for parents who benefit from child care subsidies. Despite the hardship faced by child care centers in Kentucky, our state sits well below the anticipated 40% of closure rates for child care centers across the country. Currently, Kentucky has lost fewer than 8% of its centers in the past year. But even so, we know that many programs need help quickly, and this new stream of federal funding will help us to make sure that we don't come close to that national average. We are in the process of building a child care system that works for every Kentucky family, and this is a huge step towards reaching our future goals. Again, that is $195.5 million in federal child care aid coming from the Cabinet for Health and Family Services to all of our child care providers and families who need support. Next up, we have a great agriculture announcement. It is FFA week. And so I am particularly excited to share some really good agriculture news today. The Kentucky Soil and Water Conservation Commission has selected 592 Kentucky farm projects in 86 counties to receive a total of $5.9 million in tobacco settlement funds. The money will be used for practices that improve water quality and prevent soil erosion on farmland that provides an economic backbone in rural communities across the Commonwealth. Specifically, these funds will provide more sustainable opportunities for farm owners, such as providing alternative water source for livestock, fencing to facilitate rotational grazing, or growing cover crops. Over the past 27 years, the commission administered by the Division of Conservation has obligated more than $170 million in state cost share funding. These funds are distributed with the assistance of the 121 soil and water conservation districts across Kentucky. The Beshear-Coleman administration is proud to continue this work, bringing resources and support to rural Kentucky. We understand how vital local farms are to Kentucky's economy, and we're helping to keep them productive for generations to come. Next up, we have a transportation announcement that is related to COVID-19 vaccines. I want to share information on an exciting initiative to ensure that all Kentuckians can receive their shot of hope. We want all Kentuckians who wish to get vaccinated to be able to do so, and we do not want transportation to be a barrier. Public transit agencies across the Commonwealth are offering free or reduced cost transportation to and from vaccination appointments. These services are already operating in 99 counties, covering 75% of all counties across Kentucky. Our public transit agencies are helping us meet our critical goal to provide vaccines to Kentuckians who are homebound or need transportation assistance, and we are grateful for their service to our communities. As we progress through the phased rollout of the vaccine, we know that planning for transportation may be an integral step for many Kentuckians. You can find transportation services near you right now by heading to kycovid19.ky.gov for a full list of participating public transit agencies and their phone numbers to get in touch. Across these transportation services, please know that masks are required. We must continue our actions to stop the spread, even on the way to and home from receiving our shot of hope. If you have any questions about these services, you can find more information on kycovid19.ky.gov or call our COVID vaccine hotline at 855-598-2246 or 855-326-4654 for deaf or hard of hearing Kentuckians. And last up, I have some really great pictures to share from my travels today. I was able to visit several vaccination sites across Eastern Kentucky, and I have to tell you that I just left each one of them feeling more energized and more inspired, not just from the hope that I know the Kentuckians that were getting the shot feel, but because of the gratitude that I felt for the people working in those hospitals and bearing the burden of this pandemic for the last year. So this first picture is a group of nurses at the Hazard Regional Healthcare, the Appalachian Regional Healthcare Center in Hazard. You'll notice that all of their shirts say essential. And this is a really cool thing that they've done this year. They normally give a star award to one of their employees, like an Employee of the Year award. But this year they decided that they couldn't pick just one. And so that's why all of those nurses have on the essential t-shirt, because they basically named every single employee their star award winner this year, which I thought was pretty remarkable and pretty indicative of what it means to be on Team Kentucky. The second picture that you'll see from Hazard is me again with some folks that are working in the hospital, and we have Molly, who was actually the Star Award winner from last year, who was really grateful to have the opportunity, she said, to make sure to keep the train on the tracks and to keep folks coming in for their vaccines. And it was remarkable to see. And I want to say a special thank you, also pictured here, to the Chief Medical Officer, Mariah Brahman, who was a great source of knowledge and information for me, and certainly a great sense of hope for everyone who comes through that center to get their shot of hope. So things in Hazard were pretty remarkable today. Next up, I visited Pikeville. And you'll see in this first picture from Pikeville, this is a group of pharmacists and nurses who were preparing the vaccinations and then administering the vaccinations in their drive-through line that they had set up. The efficiency and effectiveness and the infrastructure that these healthcare centers and hospitals have created in the midst of a pandemic is nothing short of a miracle. These folks were just as excited and energized today as they were when this started. And that speaks volumes to their commitment and their character. The next picture from Pikeville, you'll see I'm standing there with the folks who are directing the cars into the line. They're checking folks in, getting people lined up to be able to come in and get their shot of hope. And the interesting part about this is all of these folks work at the hospital in Pikeville. But what's great about it is these are the folks that have volunteered additional working hours, and they're also working outside of the offices they normally work in. So they volunteered and they've been moved around to be able to close gaps and make this system work as efficiently as possible. And so for these people who are volunteering their time, overtime, in places that they're not used to working in, again, says everything we need to know about the sacrifice that our healthcare heroes are making every day. And so I want to say a special thank you to Donovan Blackburn, who is the head of the hospital in Pikeville, for a remarkable tour that he gave us today, and all of the information that he shared that I can bring back with me. And of course, Governor Patton was there to greet us as well, and that was a great person to see and be able to catch up with. So last but not least, our final stop was in Prestonsburg, again at the Appalachian Regional Healthcare Center in Prestonsburg. You'll see here the pictures of the folks that I'm talking to are the nurses who are checking people in, who are administering the vaccination, and then who are checking on folks afterwards to make sure that everyone gets home safely. So we had Tim Hatfield, the CEO at the hospital in Prestonsburg. Actually, Mayor Les Stapleton and County Judge Executive Robert Williams was there to greet us as well. And we had the Mayor, Mo Bellini, and Hazard, and the County Judge Executive Scott Alexander was there to greet us as well. And that is a perfect example of the collaboration that has gone on in these communities across Kentucky. Every stop I made, we were hearing about how local government and health departments and hospitals and our school systems had all come together. Volunteers from local businesses were helping out so they could continue to meet the needs of their citizens. And I just kept thinking that this is exactly what the governor means when he says we're all on Team Kentucky. I got to see it live in person today, and I gave the governor credit. His leadership has made sure that it's assured that we are a state that is leading the nation in our COVID-19 response in many ways. And he would agree when I say this. But the boots on the ground, the people who are on the front lines doing that work every day, has made his leadership possible. And so I had a great visit. I'm more inspired and grateful than ever for the folks that I got to meet today and look them in the eye and say thank you for everything they've done in the last year and for everything they will do to get us out of this pandemic. So with that, I will turn it over to Governor Beshear.
Thank you to Lieutenant Governor Coleman. Going to any of these vaccination sites, and she's right over here, is a moving experience. It's hard to describe the emotions that you feel. It's a mix of hope and relief and belief. It's a special feeling where there's this positive energy that we've all tried to stay positive the last 11 months, but it's almost electric, and you can feel it in between people, that while you're still trying to keep some social distance, you feel this common purpose, and you can see beyond COVID for the first time in so long. So thank you for thanking all those people that are doing such great work. All right, folks, it's 5 o'clock today. It's like the remix. We're back showing photos of people doing good things. I feel like I'm supposed to yell at Kenneth or roll my eyes at some point today. But I appreciate y'all being willing to accommodate this change. Today for me was the National Governors Association meeting that I got to do in person in D.C. last year. My kids got to see a lot of D.C. They'd never been there. This year was different. But I was honored to be able to lead a session today on transportation with our U.S. Secretary of Transportation, and then just left a governor's meeting with the president. So a lot of opportunity to talk about our Kentucky needs, to put out there how many of our workers have been displaced by changes in either the energy economy, and trying to make sure it doesn't happen with the transportation economy. So please know that anytime that I get these opportunities, all I care about is fighting for you, making sure that Kentucky is heard, and making sure that Kentucky has a seat at the table to where all of our families, and it doesn't matter what party you're in or where you are in the state, that you are counted and that you are heard. All right. Today we have a COVID report that is sadly and positively, more of the same in what we're seeing. Today we're reporting 1,447 new cases of COVID-19. Now, right now, we're just barely on track to be above last week, but we can now tell you, based on the data we're looking at, that last week's numbers were depressed a little bit because of testing, which was the weather. The weather hit how many people were being tested. Last Wednesday, and this is trying to get as close to the data as we can, of last week with the weather, only 9,600 people got tested, 14,000 got tested this Wednesday. The numbers are even more stark on different days. So what I think is we're going to see a little bit of an aberration in our continued downward trend, but for the weather, we would see a continued steady downward trend. Kentuckians currently hospitalized, down 40 to 843. That's good news. 8 less in the ICU, 10 more on a ventilator. This is all due to COVID. Generally pretty stable. Our positivity rate, it's the best news of the day, down to 5.67%. We want to see that continue to drop. That's the leading indicator, as opposed to the lagging indicator, which are cases that tell us that we have had a natural downward progression. But the hard thing is we're still dealing with the impact of the winter surge, and we're still seeing the devastation that is COVID. And we've lost now well over 500,000 Americans. We talk a lot about Kentuckians, and we should, but Americans, we're all members of this country. And now that we've lost more than World War II, World War I, and Vietnam combined, we've got to know that this has been, in many ways, the war of wars, and that our loss is significant and tragic. And even as we come out of this, even as we see that hope in front of us, that we have lost so much, and our trauma is going to endure, and we're going to have to give ourselves space and understanding. As we come out of this, it's likely that there'll be those days where we think we should be so happy that there's no more COVID, but we're still hurting so much because of everyone and everything lost during it. So let's go ahead and let's try to prepare ourselves for what's to come, knowing that an event like this, with what it inflicts, is gonna take us a while to get over. And there's a question of, do we truly want to get over everything of it, with what it's taught us, with how it's shown us we are all interconnected? So let's make sure we take stock of that as we look at a light at the end of the tunnel. What brought me to this point, kind of the hard point, is that we're reporting 43 deaths today. Now, most of those are recent. Some of them are ones that have gone through our committee. But regardless, it's 43 additional Kentuckians lost, and that makes it a hard day. If there is a bright spot, only 5 of them were in long-term care, or that we know they're in long-term care now, meaning vaccinations work. If you're out there, please get vaccinated. This is the way that we get out of this and we stop having days where we lose 45 Kentuckians to COVID. Today's deaths include a 73-year-old man from Bell, a 95-year-old man from Boone, a 78-year-old man from Elliott, a 91-year-old man from Fayette, 3 Floyd County residents, 2 women ages 59 and 80, and then a 72-year-old man, a 75-year-old man from Graves, a 60-year-old woman from Hardin, a a 70-year-old man from Henry, a 21-year-old woman from Hopkins County, a number from Jefferson, women ages 70, 76, 78, and 81, and men ages 57, 63, 79, 79, 81, 90, and 97. 95-year-old woman from Kenton, a 73-year-old man from Laurel, a 79-year-old man from Laurel, a 67-year-old woman from Lawrence County. 2 individuals from McCracken, a woman age 78 and a man age 79, 62-year-old man from McCreary. In Madison, 2 individuals, both men ages 84 and 85, a 65-year-old man from Marshall. 2 individuals from Meade, both men ages 72 and 87, a 49-year-old man from Menifee. This hadn't gotten easier in 11 months. I mean, every day you feel people's loss. 85-year-old woman from Nelson. 2 men from Nelson, ages 89 and 93. A 72-year-old man from Perry. A 58-year-old man from Pulaski. A 71-year-old woman from Shelby. An 87-year-old man from Spencer. And a 72-year-old man from Taylor. You know, we've been at this so long that we could be in a place where we're numb, but who would we be? Who would we be if we were at that place? And while we've seen from some, you know, I don't want to call it indifference. Maybe it's denial. The emotions that are going to pour out of us as we come out of this, and Lord, I pray that we are coming out of this, are going to be tough. So let's acknowledge it as we go. Now let's talk about the better news. Let's talk about vaccinations, and don't let anybody tell you different. Vaccinations are going incredibly well in Kentucky. Remember when we showed you last week that we'd only gotten a fraction of what we expected in delivery, but we had put 98.5% of every first dose that had ever come into this state in someone's arm, and that's where we want to be, giving out doses faster than the federal government provides them. So let's first look at Table 1 on vaccinations. Look at that, 646,836 Kentuckians in less than a year from our first case have received their first shot of hope and are developing some level of immunity. That's at least 14.7% of our population. If you go people 18 and older, which is one of the ways that the CDC looks at it, because only one of the vaccines is 16 and up and one's 18 and up, that's 19 to 20% of our population. Now, remember, let's look at number 2, Table 2, that when you look at this, last week was disruptive. Last week, we expected on first doses to get about 71,000 doses. We got 6,825. So what we did is we used every remaining bit that was out there. It shows. I mean, we had vaccinated more than 63,871 people beginning January 5th up until last week. But listen, there's good news. When you look at this, we got 152,710 doses this week. And in a day and a half, because we get them on about Tuesday, so you can only start them on Wednesday, and this report comes out, about 10 a.m. Today. We've already vaccinated 38,522 people. That's some of the fastest we've done in a day and a half. Now, I will admit, I don't know, that was short notice that we can rise from our record of 82,578 people vaccinated in a week to 152,710. But I know everybody out there that the Lieutenant Governor talked about is trying like heck, wants to get as many people vaccinated as possible. This process is going incredibly well thanks to so many people working so hard. But I do want to make sure that you know that we will never judge ourselves in Kentucky by how quick the second dose gets to people. When we start doing that, it means we are sending it out willy-nilly. Every single second dose is for a specific individual that we want to get to that higher level of effectiveness of the vaccine. That's what the FDA tells us to do. That's what the CDC tells us to do. And that's what we're going to do. Let's talk about vaccine sites. Vaccine sites, as of our announcement today, at least 410 across Kentucky. Last week we had 291 sites, and now we're adding 119 for this upcoming week. Regional sites, we previously had 57. We're adding 6 this week. Those include Rockcastle County Hospital, Caldwell County Hospital, Cumberland County Hospital, Baptist Health Richmond, Twin Lakes Regional Hospital, and Owensboro Health in Muhlenberg. And Kroger, we have 10 new sites for a total of 30. 2 in Florence, 1 in Erlanger, 1 in Shelbyville, 1 in Louisville, 2 in Nicholasville, 1 in Winchester, 1 in Somerset, and 1 in Hopkinsville. Walmart locations are now up to 35, meaning we've added 10 new sites, and those are in the counties of Rowan, Wayne, Simpson, Davis, Union, Lincoln, Grant, Montgomery, Marion, and Pike. Federally qualified health centers, we now have 12 centers with multiple locations that include centers in Jefferson, McLean, Webster, Caldwell, Casey, Russell, Wayne, McCreary. I'm sorry, Rachel. I got moving there. And Greene counties. We have 61 local health departments. And through the federal pharmacy program, which includes Walgreens and independent local pharmacies, there are now 215. And let me tell you, when Johnson & Johnson is approved, based on our current plans, we're going to have a lot more independent pharmacies out there that are ready, willing, and able to step up to the plate and to help their communities. I personally appreciate their patience. I know their ability. I know that they are pillars of their community, and I can't wait to see what they're able to do when we're able to turn on a new program. So now we have new maps to show you how much we continue to grow our vaccine efforts. So let's start with the first one. Is this one I asked about, Kenneth? Here is where we were many weeks ago. Keep going. And we grew. Keep going. And we grew. And we grew. And we continue to grow. This is a month and a half. This is how we are building out. Our goal, especially when we hit very significant supply, is to make sure it's in your neighborhood. Now listen, especially as we move into 1C, it's going to be tough to get an appointment because everybody wants it, and that's a really good thing. That means we have the enthusiasm to get to herd immunity and to defeat this thing for good. That is a good thing. I know it's hard if you can't get an appointment to think my inability to get an appointment is a good thing. It's not for you, but it is for us, and ultimately for you to get to that point where you can take your mask off and get back to an old normal. It's a good thing too. So let's remember the collective, the we, is what it takes to defeat this virus. And with all these sites, we are on our way. Now, I'm sure that I missed something because I ran down here right as the Lieutenant Governor was about to start. I did, which is long-term care. I ran down here so the Lieutenant Governor was about to end. 9 new residents, 11 new staff testing positive all around the country. Cases are plummeting in long-term care. And with the damage they've sustained, this is incredible news. We do have 15 new deaths that are attributable to long-term care. They've been reported in previous days or weeks. We do have 2 new facilities that have a positive case. But long-term care are proof that these vaccinations work and that they protect people. All right, with that, let's turn it over to questions. We got a list here. Let's start with Tom Latek from Kentucky Today.
All right, good afternoon, Governor. Thanks for letting me lead off today. I've got 2 for you here. First of all, When will the restrictions on church capacities be lifted above 50%? And I've also gotten wind that Ohioans are making plans to come to the Covington Kroger site to get their vaccination, kind of jumping the line there, not to mention the state line. Are there any safeguards in place to prevent that from happening?
Yes, thank you, Tom. Today we did learn that a number of Ohioans, about 1,000, had scheduled at least through Saturday at our Covington facility. We have fixed their ability to sign up based on zip code, but for the people that showed up for a vaccine, we did go ahead and vaccinate them because, listen, I mean, they're people too, and they can spread it across their river. Now, I am personally going to ask the federal government for every individual we vaccinated from Ohio to get at least that amount of allocation from Ohio, who otherwise is getting that allocation. And this is one of those things that test us as people, right? We get an allocation for Kentuckians. You have somebody in need that shows up that might not be one of your citizens, and while we don't want it to happen, turning them away is a different question. And I hope when we dig down to our values and our faith that we hope that we can give that person protection. We can stop the issue from happening in the future, and then we can get those extra vaccines coming back to us because it's our job to vaccinate our own citizens. On restrictions on church capacity, obviously those haven't been mandatory in a while. I've been talking to a lot of church leaders because we are headed in the right direction, especially those leaders that have only had virtual services. If we continue to see the direction we're on as vaccinations increase, I think there is a lot of new opportunity. Now, I mean, church, it raises a lot of questions. I mean, if you're going to have a capacity, do you can you have a first come, first serve? How do you do that? I know that's tough on our ministers and our pastors and our rabbis and others, and I know that they are working through that. Certainly, there are some things that spread the virus more than others, singing, and then the ability to wear masks. But we are certainly entering a phase where I believe we're going to be able to provide more opportunity, whether it's for in-person worship or other things than we have in the recent past. Mike Valenti from WLAX. Oh. Let me pause on Mike.
Thank you, Governor.
If you can. Hey, Mike, I skipped over our UI update. If you're good with it, let's do that, and then I'll come to your question. Does that work?
Yep, that's fine.
Okay, let's go to Amy for our UI update, and then we'll come back to Mike.
Thank you, Governor. I'm here today, hopefully with some good news and some information for you. Some information about our numbers. We've been looking more and working more on the our older claims. I can let you know that of the 695,000 claims from unique claimants that we had from the beginning of the pandemic through the end of December, 86% of those have been deemed payable, which is far outstrips our payable rate prior to the pandemic, which was just 70 to 75%. Only 8% have been denied. We have about 6% of those without fraud issues left to work, and almost 50% of those are from the fourth quarter. So the Office of Unemployment has made fabulous progress on the unemployment claims, which rival those just for the filings from 2020 of those across the Great Recession. So they have been working so hard to make sure that you get the benefits that you are entitled to. And I would also like to let you know, too, that we believe that we are back to our on-time payment rate that is comparable to that was pre-pandemic. So, again, kudos to the Office of Unemployment for getting that number back up where I know they wanted it to be. Next, a little more information. I know there was a lot of press coverage from the cyber attack that the Office of Unemployment had yesterday. The filing system was hit with a directed cyber attack yesterday morning. The good news is that our Commonwealth Office of Technology and our Office of Unemployment recognized the issue, and they were able to prevent any intrusion into the system. They are monitoring closely for any additional attempts, but they did stellar work in protecting our UI system from a breach, and no UI users' data was stolen. We're very excited about the fact that even though these attacks are going to happen, particularly with the federal programs that have so many dollars available, our office was able to fend off that attack and keep the system only down for about an hour. It was back up yesterday at 3:25. And then the back end of the system where people work on the claims was never down or affected. So we were still able to help work claimant claims while the filing front end part was down. Just so claimants understand, in order to stop that attack, we had to deploy a CAPTCHA system. You may recognize those where you have to click that you're not a robot, you're not a computer. It's a common thing to stop spam and stop these kinds of attacks. It should not be difficult. We have not heard any issues of claimants having trouble accessing the system as a result. It gives us just one more additional layer of security, but it should not make it any more difficult for you to log into the system. This will be my last update on the Bank of America debit cards. You've got to spend that off by Sunday, the 28th, or Bank of America will return those funds to us. We'll reissue those as a paper check, but understand that that means there will be delays in getting that money. So do try to spend that money off by Sunday. One bit of information about fraud. I know we've talked a lot about fraud. Our numbers for January, as we've worked some claims, our fraudulent filings are down to about 70% of those that are still unresolved. But we have now put up the form on our website that you can report any fraudulent filing, any letters you receive, or if you're an employer and you have get a notice of a claim that's been filed for an employee who's still working or never worked for you. If there's a screenshot up there now, about halfway down the page, you can see there is a big orange button that says unemployment insurance fraud. If you click on that, there will be a form you can fill out. You don't have to email now. If you have emailed, you don't have to fill this out again. We are still working things in the order that we received them, and we will get to them. If you fill out, and then if you miss it here, if you scroll all the way down to the bottom, and that's our next slide that we have, there is kind of a menu across the bottom, and you can see there is a place to report UI fraud as well. Either link takes you to the same page. So if you fill that out, someone will reach out for more information if they need it, and we will take care of that. But please know that this information is bought on the internet from data breaches, and they are filing these in multiple states. We are getting a lot of filings from out of state, and we are getting reports from Kentuckians that they are getting letters from other states. So we have recommendations on the kcc.ky.gov website that you can follow if you think your identity has been stolen. The Attorney General's website has very good information as well. Please know that we have been working with local law enforcement partners to try to prosecute those who are committing this fraud. And we've been able to identify, or starting to work on identifying some of those. And we think that there will be several prosecutions in the coming months against those who are committing the fraud. One last very short issue, U.S. Department of Labor issued new guidance just this afternoon regarding the Pandemic Unemployment Assistance Program. You may start seeing some media coverage of that and have some questions. Please know that we are digging through that guidance, and we will have an update for you next week on any changes that we need to make in response to that. And that's it.
All right. Thank you, Amy. And now we'll go back to Mike Valenti, who's been very patient from WLEX.
Yeah, thank you, Governor, and good evening. Have you and Dr. Stack and other advisors had any internal discussions about the possibility of issuing guidance for people who have been vaccinated, fully inoculated, gotten both doses? And at what point do you think people can, I guess, start to release their foot off the gas?
So we're awaiting the CDC, which says they're going to come out with that guidance here soon. We want to be able to review that. Certainly, individuals who have been fully vaccinated around individuals who've been fully vaccinated are safer than a mixture of the two or people who have not been. Though we still don't know yet, though we're seeing more and more information on whether you can transmit it to each other. So while there's a lot of uncertainty there, I feel like it is going to get resolved here in the near future. We've certainly been able to let our foot off the gas in terms of visitation at assisted living and other senior living that is not governed or regulated by the federal government. We are looking at other opportunities to do that in terms of capacity across the economy and the current restrictions or limitations that are still in place. So I think we're all kind of waiting with bated breath to see what the CDC says. And certainly this gets easier as more of the population is vaccinated, which I think is happening at a rapid rate. Corinne Boyer from WEKU.
Hi, Governor. What percentage of the long-term care facility population needs to be vaccinated before we start to see fewer deaths occur? And then are long-term staff getting the vaccine more regularly now, or is there still some hesitancy around getting vaccinated?
So Monday, we're going to put out a full report because we believe our long-term care program, at least the initial part, is ending. Certainly everyone who wanted a vaccine in both long-term care and or who work in it have now been able to get both doses. We are already seeing a precipitous drop in deaths in long-term care, and the share of deaths, long-term care versus non-long-term care, is changing dramatically. It is really strong proof that the vaccines work. It is good for our seniors in long-term care. It's good for our long-term outlook on ending this tragic loss of life. It does tell us that we need to continue to be careful and that a lot of people have passed away outside of long-term care. When we get those numbers back, we will only know who opted in the specific program for long-term care. We won't know how many of the workers said no in the specific program and then went to a regional site to get vaccinated. I think what we're going to see is a high percentage of residents and a middle or maybe even a slightly disappointing percentage of long-term care workers. Though again, I think that's just the initial offering of it. I think that ought to reinforce that we got to continue to message the right way. And let's also remember that they were the very first people offered a new vaccine. Even right now, it's a lot different than when it was offered from them. And so we're going to need to give them a little grace and when and how they were offered it when they hadn't seen anybody else take it. And then remember, they're in 1A. So they can go anywhere right now and get that vaccine, and we want them to, even if they said no originally. Alex Akisto from the Lexington Herald-Leader.
Hi, Governor. You've announced previously that Kentucky's regional vaccine sites will begin collectively opening to 1C starting March 1st. But you've asked smaller sites like public health departments to focus more on giving doses to stragglers in 1A and 1B. Can you talk a little bit about how you're directing them to do that and whether you're telling them to begin the transition to 1C at a particular time? For example, can health departments order doses for 1C now? And at the regional sites, are you planning to boost staffing and hours once you do open to 1C, since, as you mentioned, it's at least 1.3 million more people? Thanks.
So staffing is entirely dependent on the number of doses we get. So regardless of the population that can get through the doors to be vaccinated, it's really the supply that dictates the number of people that we need. I wish we had more supply. And right now, this week, Alex, we're going to see how much our current staffing can do. Because remember, we have 152,000 doses because of last week. And we're really going to get, in many ways, an important test where we learn how much a given number of people can do. Can we pick up the pace, or what does it take? All right, so our local health departments, especially in some of our smaller places, I mean, they have so much purpose, and they do this for a living, and they've got really good judgment when it comes to their community. So for them, what we can really give is priority, and they live out the priority, better than any regional center ever could, with volume and different ways to sign up. So what we're telling them is you can begin 1C, and the numbers they get are based on population in the program, and they won't change based on how they're giving them out. But if we know anything about our local health departments, if we set a goal and we let them know their critical role in this, which is to make sure, especially those 70 up and then 60 to 70, get a priority, we know they will go out and do it. They've been doing it every time. They've been incredible in our equity efforts and continue to say yes. So they're going to be able to do 1C. And in some communities, that's probably what they will focus on. In others, where we have a larger senior population, I know they'll be more targeted. They've been incredible during this crisis. And we know that they will continue. And that gives us faith as we move to 1C, that those that haven't been served in 1B, you're not being left out. There's still a group out there that is going to live and breathe every day in their professional job to make sure you get your vaccine. John Boyle from WFPL.
Hi, Governor. I don't think I've taken advantage of these to double up on questions over the past couple months, so I'm going to take that opportunity to do that this time. So we'll start with the data-heavy question. So we've seen a pretty stark increase in death over the past couple days, whereas over the past couple weeks, they're pretty low, a lot of times even under 20. So I wanted to hear, number one, what are the dates of these deaths that are being counted right now, if we are able to get those? And what do you attribute the recent uptick to? And as far as the second question goes, switching gears a little bit, wanted to hear a little bit about hairstylists and barbers, and just thoughts on your administration not considering them essential or including them in 1C.
First, hairstylists and barbers, let me tell you, have done an incredible job in this pandemic. They have shown that if you follow the guidelines well, you can prevent the spread, even if you have the virus. They were one of the first groups who were back in our reopening and have been operating in a safe way. So I hope nobody thinks that this administration doesn't recognize the great job that they have been doing, the safe way they've been providing services. Not being in 1C is wholly dependent on the CDC and how they put together their list. But to those groups, keep doing what you're doing. You're doing a great job. And given that other people are in there, vaccines alone don't make your business safe. What you're doing right now and the practices that you're using make your businesses safe. So thank you. Right now, as long as you walk in and it's like everywhere else that we see, it's one of the safer places that there are lots of people to be. So on the data, we can get you the actual dates of death from today. The vast majority are February, a decent amount are January, and there are probably eight or less what I would call historic deaths where we had to get more paperwork, or there had to be a stronger determination of whether or not COVID was a significant factor in the death. So if you remember early on, all the criticism out there was people were dying from something other than COVID. So we put a very strict policy in place to where if somebody was counted in this list, if we were going to say it was the toll of COVID, that we had done our homework. So, I mean, on today's that I read, it's February, January, February, December, February. Here's one of the historic: September, January, December, February. Okay, so we'll get you all the other dates, and that way you all can do your analysis. And thank you for not doubling up until now. Chad Hedrick from WKYT.
Hey there, Governor. Question in regards to, as we have more vaccine sites coming online, how is it determined of how many vaccines go to each of these sites as we get more coming into the state?
It's a good question, and it's not perfect, but it's primarily based on population. Oftentimes we look at the area development district because it's a lot easier to look at region for population, but as we get more vaccine, we're going to be able to look in smaller and smaller areas. It is driven by population at the moment, and that is our prime mover. It's also driven, it's important, on what the limitations are on the size that we can ship. So Moderna, that's 100. It's a little under 1,000 on Pfizer. So areas that population-wise may be a little bit smaller, where you wouldn't have 1,000 vaccines, it's 900 something. We'll be getting Moderna. Some of the bigger areas may be getting more Pfizer because in an allocation by population, that makes sense. Debbie Yetter from the Courier-Journal.
Hi, Governor. With the regional sites opening to 1C on Monday, I guess, with priority given to 60 and older, do you expect to be able to accommodate the 70 and older who have yet to get vaccinated? I understand there seem to be a number of those folks still trying to get appointments.
We do. Again, it doesn't mean that individuals won't be frustrated and how to sign up and when to sign up. That's just everybody wanting this life-saving vaccine. It's two things. Number one, at least in our Kroger regional sites, they have worked their computer system to provide preference, especially to those over 70 as we move towards 1C. The other piece is local health departments, especially in smaller communities, working directly with waiting lists, with people that they know, and then sometimes in senior living settings. We're talking a lot about Johnson & Johnson right now and what it's going to allow us to get to homebound seniors and others and only have to go once to give them a highly effective vaccine. And let me make sure I make this clear to everyone. When Johnson & Johnson's approved, we will have 3 incredible life-saving vaccines. All of them come close to eliminating severe illness and death, and that's where we want to be. So if you get offered the Johnson & Johnson or the Moderna or the Pfizer vaccine, take it. Take it. They are all incredible. They're all better than anything we ever hoped for or was projected to us. So you're gonna see a number of efforts. As we move to 1C, a lot of what we have in 1B are harder to reach populations, and thus it's targeted programs. We think big and we think small. Jeff Mulvihill from the Associated Press.
Thank you, Governor. I have a UI question. With the fraud problems that Kentucky and other states have seen so far under PUA, I wanted to know what the state's doing to avoid similar issues with the expected next round of extended and heightened benefits.
Yeah, let's go to Amy Cubbage, and we have seen, you're right, a huge, a significantly escalated amount of fraud based on the December announcement and from there. And if that trend continues, it could be even more problematic. And for Kentuckians and everyone else, every fraudulent filing that's not immediately flagged and expelled makes it harder to get to the legitimate one, because if you got to work your way through, let's pick random numbers and let's make sure that people know they're not accurate numbers. If you got to work through 100 claims and 90 of them are fraudulent and 10 of them are real, when do you get to the 10 that are real? It makes it harder to help people. But let's go over to Amy.
We're actually doing several things right now that we expect to ramp up as, if the PUA extension comes through, which is expected to be through the end of August. One thing that we have already done and then other states are starting to roll out, I know Kansas recently rolled this out, is we have our ID verification product that was in place pre-pandemic that is catching about 99% of the payments. The letters are going out to claimants telling them that there has been a claim filed, but it is stopping any claims being paid. So while it's a burden on the system, it is also stopping the billions of dollars of payments, of fraudulent payments from going out that other states have seen. So that's one good thing that we have. We are all getting ready to roll out a back-end second ID verification to catch anything that gets through that first level of ID verification. And in light of the significant number of out-of-state fraudulent claims that we're seeing, we are taking and catching and giving a hard look at all claims filed from out of state. And we are doing searches to catch other fraudulent indicators. I don't want to announce what those indicators are so that people committing the fraud don't then try to figure out a way around them. But we are taking all the patterns that we're seeing in the fraudulent filings and trying to run searches and flag those in our system so that we can segregate those to the side and work on the legitimate claims. But it is something that we are cognizant of, we are concerned about, and we believe that we will see continue if the PUA program is re-upped by Congress.
All right, everybody. We'll be live again at 4 p.m., back again at 4 on Monday. But I'd be remiss if I didn't mention that we are just about 10 days away from the 1-year anniversary of our first case here in Kentucky. I keep thinking just about every day about March 6th last year. It was this beautiful day, one of the nicest days we'd had in a while. And it was a Friday, and I left a little bit early from the office. I wanted to go home and see the kids. I was in a great mood, even though that we knew that the coronavirus was out there. We were hopeful about what it might or might not do. At the time, I had 2 dogs that were waiting for me to get home. Our lives are dramatically different than March 6th of last year. We are all sustained loss. We are all feeling lost. And there is a collective grief in this Commonwealth that is greater than I could have imagined in my lifetime and greater than I knew that I would have to try to lead us through as governor. I hope I've met your expectations in doing that. None of us could have known what this journey was, and none of us had the answers in the beginning and not all the answers now. But as we approach a year, there's a lot of hope in front of us. There's a chance to move beyond this. But to do that, I need your collective spirit, your resiliency, and your compassion in a way that we saw early on in this pandemic. These last months, and we know it's now just months, at least I pray, of this pandemic are critical to protect those around us. So let's continue to do the right thing. Listen, I've been vaccinated, yet I'm still wearing my mask. My mask's plural every day. And that's because I want to make sure that those around me that haven't yet been able to get in are protected as well. And we talked about this being a test of our humanity, and the test isn't over until it's over. So let's make sure we continue to do the right things. I want to thank everybody. This last year has been tough on us all, and some people will sometimes say, it's been tough on you or offer their support. It's been tough on all of us. All of us. Give yourself space, give yourself room, give yourself grace and empathy, and then give the same to those around you. Our collective healing will hopefully begin here soon. We're all excited to get out of this, but it's going to be a process moving forward. Our best days, they're coming. They're coming. And it's going to be incumbent on us to make sure that they are the very best days they can be. And let's make them incredible. let's make sure that we don't forget who's not there with us. So we'll be working on plans for March 6th to make it fitting the year that we've been through. Maybe every March 6th moving forward, we'll remember what we've been through and what it took collectively to defeat it. Let's keep working towards that goal. We're going to get through this. We're going to get through it together. We're going to come out on the other side. Thank you, Kentucky. God bless. We'll see you again on Monday.